to We Help You Home, the podcast where we help seniors and their caregivers find the resources, support, and knowledge that they need to age safely and happily at home. I'm your host, Rob Steinbrook, and today I'm joined by Dalia Brem, Vice President of Business Development for ATEX Health. Dalia has spent years guiding families through home health and hospice services, helping them understand who qualifies, what's covered, and how these programs can change lives. We're going to break down the benefits, the process, and hear some stories from families she's helped. Dalia, welcome to the podcast today.
Rob, thank you for having me.
Before we get into the details, I'd love for our listeners to really get to know you. How did you first get into and get started with home health and hospice?
Well, Rob, my background is actually in advertising, but about 25 years ago, I lost my sister to cancer. And at the time, I didn't know much about home health or hospice. And in trying to find out what resources were out there and how we could help, that's how I came about. After my sister passed, I sort of took a little hiatus from advertising, and I decided that I wanted to be one of those resources that, the people that helped us. And that's how I got into home health and hospice.
Wow, that's a very personal story, and it's a very personal journey that led you to a calling, really, in life. And I appreciate you sharing that with
Mhm.
us today, Dahlia. And in your role that you currently have as Vice President of Business Development for ATEX, what does your day to day look like, and how do you interact with patients, families, and healthcare providers?
Well, my day to day consists of a lot of phone calls, a lot of emails. That's usually how I start off my day. But I do have different teams that are out educating and talking with doctors, families, facilities, and talking to them about the benefits of home health and hospice. I myself, I try to see as many people as possible. I like to talk with the families, interact with them because, again, it's a personal mission that I have, a personal experience that I have. And I want them to know that there are other people who have been in their situations, and I want to help to put them at ease as well.
A lot of people have heard the term home health, and we hear that thrown around a lot of times, but they're not always sure what it really includes. Could you walk us through the kinds of services that home health provides?
Sure. So, home health is meant to help anyone who perhaps is, maybe going through something currently, a medical condition. Perhaps they're needing some physical therapy, maybe some skilled nursing. So, home health is meant for someone who is homebound, someone who has a taxing effort, who can't really go out to an outpatient therapy or to go out continuously to see a nurse. This way, home health comes to their home and provides them the services of nursing, physical therapy, occupational therapy without them having to leave their home.
That's nice, like concierge services right at the house,
That's what we
isn't
like
it?
to provide. Yeah, absolutely.
And who typically qualifies for services like home health, and how does someone start that process? Do they have to wait for their doctor to suggest it, or could they ask for it themselves?
Well, it's actually both. A patient, if they feel that they have a need for skilled nursing or therapy, they themselves can find a home health agency or they can call the office, and we in turn will then contact their doctor's offices. You need an order. And they must have a skill need and they must qualify. Qualifying meaning that they can't, sorry, they must be homebound. It must be a taxing effort to leave the home. At that point, we will contact their doctor's office, ask for an order so that we can go out and do an evaluation and treatment.
When people think about the word homebound, sometimes they think that that's somebody that's totally shut in and can't get out at all and they never leave the house. But that's not really the case, is it?
No, homebound just means that it is a taxing effort to leave your home, but you can still go out to religious services, maybe to the barber or beauty shop, and of course to go see your doctor.
So that would really encompass more people than we might think when we think of the word homebound. When you look at signs that a family should look for, and when you think about helping family members, what are some of the signs a family should look for that tell them it might be a time to consider home health?
With our aging population, a lot of times we start to see patients who are having a little bit more trouble getting around home. Perhaps it's taking a little bit more effort to maybe make it from the living room to the bedroom or to the bathroom. Anytime you have someone like that, it may be a good time to at least get an evaluation to find out if there is something that we can help with. For instance, maybe some additional therapy. Maybe they're on a new medication that we can send nursing out to help educate, maybe perhaps on timing that medication, just to make sure that they're not getting sleepy, maybe at 10 o'clock and missing meals and things like that.
And you mentioned the education part of it. Sometimes people just need a little help managing their medicines, I guess, don't they?
Absolutely. There's a lot of things that home health can help with. Like I mentioned, it may be someone who's not feeling well. And home health is also can be temporary. For instance, if it's someone's having a surgery and they're going to need a little additional help after that surgery, that's a good time to bring in home health.
Well, let's move on and talk a little bit about hospice. That's
Okay.
a word sometimes scares people away.
Scares people away, and honestly, hospice is not a scary word. It should not be.
Yeah, I think that hospice really should be looked at more like elevated care as compared to home health. It's like a whole nother level that gives you more hands on deck, doesn't it?
Absolutely. There are so many additional benefits to hospice that I think a lot of people, again, the misconception of hospice, to qualify for hospice, you must have been diagnosed with a terminal illness and not seeking any aggressive treatments. But again, hospice is for anyone who has been diagnosed with a terminal illness, which, if it runs its normal course, they should live or could live from anywhere from 6 months and less, not seeking any aggressive treatment.
Do people sometimes go on hospice and then maybe improve? And what happens then?
Oh, absolutely. We have had patients who I want to say quote unquote graduate to home health. And again, it's 6 months or less, but running its natural course, someone could stay on hospice for up to a year, and at that point, we can convert them over to home health and continue to monitor them. Not as often as hospice, maybe 2, 3 times a week, just to make sure that they're still on the right regimen, medical regimen, and making sure that they're checking in and out with their doctor.
So it's really not like a one-time deal that, once you qualify for it, if you don't pass, then you lose the benefit either, is it?
No, absolutely not.
From your experience, what benefits do families often not realize hospice can provide, whether it's medical, emotional, or even spiritual?
Well, with hospice, it provides them with all the medical equipment related to that diagnosis. Hospice also provides family with bereavement and spiritual counseling for post death up to 1 year.
Wow, so there's extra care that's there for not just the patient, but
But
for the
for the
families
family,
as well.
absolutely. Hospice is intended to help, obviously, not just the patient, but the family. And the family is who we are caring for as well.
So it's more of a holistic approach, I guess, isn't it, when you
Absolutely.
think about it? Well, what about costs? When you think about costs, they say everything has a price tag on it, and we know that things do cost money. This is one of the first questions that people often have when you get into subjects of healthcare in any way, shape, or form. How do Medicare and private insurance usually handle home health and hospice?
Medicare covers hospice at 100%. Now, if we're talking about home health, a patient may or may not have a copay or deductible. If that's the case, we never like to deny health care to anyone, but our financial team will reach out to the family and discuss any of the deductibles and copays. And then if there's any way that we can help, by all means, we will do that.
So sometimes there is copays and out-of-pocket expenses for the home health side of things.
Yes, that is correct.
Over the years, you've worked with a lot of families and helped a lot of people with different home health and hospice needs. Could you share a couple of stories that really stand out where you saw home health or hospice make a huge difference in their lives?
Oh, absolutely. I could tell you, I could go on and on for hours, but I can tell you, for instance, of one particular family that initially, when we went out to talk to them, they were absolutely adamant against hospice. And after speaking with them and bringing on their loved one onto services, and of course, we went through the entire process of nursing and our clinical staff going out to meet. When the patient passed, I received a phone call from the sister of the patient, and she was crying. And I thought perhaps, oh my gosh, what went wrong? Did something happen? And she said, I can't tell you what a difference you made or what your team made in my life and into my brother's life during the hospice process. So that to me said, we're doing the right thing. We're helping families out there. And that is our goal, is to be able to help and, again, try to take away the misconception of what hospice is.
What's one thing you wish every caregiver knew before they reach the point of needing these services?
I think there's a lot of unanswered questions for caregivers, for families, not knowing when to make that decision. And I think that maybe if they reach out to an agency and ask those questions, that way they can help put them at ease and they know exactly when it's time to call in home health or hospice.
For anyone that's listening right now who thinks they might need home health or could benefit from hospice services, what's the very first step that they should take?
First thing they should do is talk to their healthcare provider. If they feel that their loved one has a decline or maybe could use some additional help in the home, reach out to them, tell them what they're seeing in the home, and then their caregiver can either give us a call or they can call us directly. We'll be happy once again to come out and do an evaluation and assessment. There's no cost to do something like that. And again, there's no cost to give us a call and for us to answer any questions that they may have.
And how can caregivers best advocate for their loved one's care within the medical system?
Keep in mind that we are the voice for the patients, whether it's our parents, our brother or sister, aunt or uncle. So the first thing to do is make sure you do your homework on these agencies. There's always Medicare.gov. There's always, of course, friends and families that maybe have used these companies before. Do your homework and make sure that you've reached out to the right company. You do have a choice on who you choose for healthcare. And you do have a choice on who you choose for home health and or hospice, not just because someone referred them to you. Does that mean you have to use them? And if at any point throughout having them on their services you aren't happy, you do have the choice to choose someone else.
If someone wants to learn more about ATEX Health or the services that your company offers,
The easiest thing to do is to go to our website at atexhealth.com. We are also on social media platforms. Find us on Facebook, on Instagram. We're also on LinkedIn. And if not, feel free to call your local branch.
what areas does ATEX cover?
Currently, Rob, we're here in Texas. We cover Austin, San Antonio, Corpus Christi, and down in Rio Grande Valley.
Well, I appreciate you coming on today, Dalia, and really giving us some good information about home health and hospice and giving us an overview, and hopefully that puts some of our listeners to ease and as they're looking at making decisions and possibly bringing in extra help into their own homes. So thank you so much for being here and joining us today. And thank you for listening today to We Help You Home. If today's episode helped you, or if you found it beneficial, or maybe you know somebody that could benefit from this episode, be sure to like, share, subscribe. For more resources, be sure to check out ATEX Health's website. And remember, you're not alone on this journey. We're here to help you home.